Good evening, everybody, and welcome to our Zoom session on Is IVF Right for Me? सगळ्यांचं स्वागत आहे. Everybody welcome. And we chose this topic today because I think especially after the lockdown and even through the lockdown, when people have not conceived and they have been trying for a long time, these questions have started coming up in the mind more frequently as to, is there some problem, any reason why conception is not happening? One. Secondly is maybe there are a few people who have been advised IVF and they have had this time to contemplate on whether they should go ahead with IVF treatment. So that's the reason हमने ये टॉपिक चुना है, ताकि जो भी IVF के बारे में हमारे सवाल हो, क्वेश्चंस हो, जो अभी तक शायद पूरी तरह से आंसर नहीं हुए हो, और ड्यू टू दैट हम हमारा कदम उठा नहीं पा रहे हैं उस ट्रीटमेंट की तरफ, वो शायद अगर हम एड्रेस कर ले तो इट विल बी गिव अस सम क्लैरिटी ऑफ माइंड रिगार्डिंग कि आईवीएफ मेरे लिए, हमारे लिए एज अ कपल सही ट्रीटमेंट है या नहीं। अगर आईवीएफ करते हैं तो उसके पहले और उसके दरमियान क्या क्या करना चाहिए और आगे कैसे बढ़ना चाहिए। So on behalf of Xenith Advanced Fertility Center, I welcome all of you. Before I start, I just like to give you a small brief introduction about myself. I am Dr. Mamta Dighe. I am the director, founder director of Xenith Advanced Fertility Center. इसके पहले I have been the director of IVF Pune, which is the IVF Center of Dinanath Mangeshkar Hospital. I'm one of the first few board certified reproductive medicine specialists in the country. And I have worked in this field for more than 20 years now. I have been doing this since 1999. I have worked for a very long time with Padma Shri Dr. Kamini Rao, who is one of the pioneers of IVF in this country. I've also been, as a part of the secretary and health positions in various infertility organizations in the country. At Wakad, we have Xenith Advanced Fertility Center, which is in Wakad in Pune. It's an advanced center. We have full-time embryologists, और जो भी IVF के साथ जुड़ा हुआ है, वो हम सब treatments वहाँ करते हैं. So let us now start with, our session on whether is IVF right for me. So first and foremost, just a brief introduction about कि ये pregnancy की process होती कैसे है. Most of you who are here on this chat today, I am sure आपको ये मालूम है कि pregnancy, naturally conception कैसे होता है. You are probably here on this chat क्योंकि आपको कहीं ना कहीं किसी ने शायद या आप खुद IVF के बारे में सोच रहे हैं. So basically, जो female reproductive होता है, that is the female reproductive tract के organs होते हैं, the uterus, fallopian tubes and the ovaries. Of course, the part of the cervix and the lower vagina. और males में रहते हैं sperms. So basically, every woman is born with a set number of eggs. When we are born as women, as little girls, हम जन्मते ही ovaries में अंडों का स्टोर एक लेकर पैदा होते हैं. उसके बाद उस ओवरी में कोई अंडे ज्यादा डाल नहीं सकता है. जो भी हमारे पास रिजर्व है, वी कॉल दैट एन ओवेरियन रिजर्व, वहीं से हर महीने में वंस मेंसेस स्टार्ट अंडे बनते रहते हैं. एंड देन जब ये अंडे बनते हैं तभी अगर इंटरकोर्स हुआ, सो एवरी मंथ one egg will develop from this ovary. It will come out of the ovary, which is called ovulation. और जब ये ovulate होता है, उसी टाइम if we have intercourse, जेव्हा बीज अंडकोशातून अंड बाहेर पडतं, ज्याला आपण ओव्ह्युलेशन असं म्हणतो, आणि त्याच वेळेला त्या सुमारास जर आपण इंटरकोर्स ठेवला आणि ते स्त्रीबीज जर फलित झालं त्या शुक्राणूंनी आणि जर त्याचा गर्भ झाला, कारण ते स्त्रीबीज फॅलोपियन ट्यूब मध्ये जातं. फॅलोपियन ट्यूब मध्ये, in the fallopian tube, the egg and the sperm meet, it forms an embryo, and then the tube pushes the embryo into the uterus where it sticks and then grows into a baby. Now, if this is clear, we all understand that for any couple to conceive, you need to have 4 basic factors to be functioning right, which is the eggs have to be good in quantity and quality, and you have to ovulate in time. The sperms in the man or the male partner have to be adequate in quantity and motility, that is movement. Both the tubes which are by the side of the uterus have to be healthy and open and functioning well. And the uterus has to have a capacity to let this embryo implant in the uterus. Right? So ह्या जर चारी गोष्टी, eggs, sperms, tubes, गर्भनलिका and the uterus किंवा गर्भकोश चांगल्या असल्या तर प्रेग्नन्सी नैसर्गिकरित्या व्हायला मदत होते. या चारीपैकी जर कुठेही प्रॉब्लेम असला तर अडथळा निर्माण होतो. This is the basic process of normal reproduction. So what is IVF? Now let's just try and understand what is IVF. So what is IVF? IVF is, if you understood this, it is clear that the whole process of pregnancy or conception is happening inside the body of the woman. जिस तरह से स्पर्म शरीर के बाहर आते हैं और उस एग को फर्टिलाइज करते हैं, उस तरह से स्त्री का अंडा शरीर के बाहर कभी नहीं आता है. सो ये जो पूरी प्रेगनेंसी की प्रोसेस है वो स्त्री के शरीर के अंदर हो रही है. So whereas in IVF हम क्या करते हैं, ये जो अंडा होता है which is ovulating from the ovary, वो हम ओवरी से निकाल लेते हैं और वो जो अंडा हम निकालते हैं उसको लेबोरेटरी में स्पर्म के साथ फर्टिलाइज करते हैं. लेबोरेटरी में उस एम्ब्रियो को ग्रो करते हैं, नर्चर करते हैं, और जब वो एम्ब्रियो 3 से 5 दिन तक लेबोरेटरी में ग्रो होता है, उसके बाद we take that embryo and put it back into the womb or the uterus of the woman. So in short, when you say IVF, it means in vitro fertilization. In vivo means when it happens inside the body. In vitro means when it is happening outside of the body. So that is why we call it in vitro fertilization, या हम उसको colloquial language में test tube baby भी कहा करते हैं. ये embryo जो है, this does not grow in a test tube, it grows in a small dish, but it was called test tube baby, so that is why it is continued as test tube baby. So in this IVF, the whole process is taken over by the laboratory and the embryologist, जिसमें हम इंजेक्शंस द्वारा बहुत सारे अंडे तैयार करते हैं. वो सारे के सारे अंडे शरीर के बाहर निकालते हैं थ्रू अ स्मॉल प्रोसीजर, एंड फिर वो अंडे लेबोरेटरी में एम्ब्रियोलॉजिस्ट स्पर्म के साथ फर्टिलाइज करके एम्ब्रियोज ग्रो करके अंदर डाल देते हैं. So now you know what happens in a natural conception and you know what is happening in an IVF, right? But the basic question जो सबके दिमाग में होता है is IVF right for me? क्या मैं IVF के लिए सही candidate हूँ? That is the question, because we don't want to unnecessarily do an IVF. At the same time, we do not want to unnecessarily delay an IVF. That is why understanding कि क्या मैं सही candidate हूँ becomes so important. Now, instead of just giving you कि ये reasons है IVF करने के लिए, I've just tried to make it very clear so that you know anybody who is in this position will be able to pinpoint where they stand today and easily understand whether they are the right candidate for IVF. So what can be, who is the right candidate for IVF? The first factor is when there is an absolute indication for IVF. Now, what do you mean by an absolute indication for IVF? Absolute indication means जहां IVF के बगैर काम ही नहीं होगा, जहां IVF के बगैर प्रेगनेंसी पॉसिबल ही नहीं होगी. So ऐसी कौन सी कंडीशंस है जहां IVF के बगैर प्रेगनेंसी पॉसिबल ही नहीं होती? So the first condition is when both the fallopian tubes are blocked. अगर दोनों जो गर्भनलिका होती है, फेलोपियन ट्यूब्स होती है, ज्याला आपण गर्भकोशाच्या बाजूच्या ज्या गर्भनलिका असतात त्या जर दोन्ही ब्लॉक्ड असल्या, बोथ ऑफ देम आर ब्लॉक्ड, तो एग और स्पर्म को मिलने का रास्ता ही नहीं रहता, एंड दैट इज व्हाई दैट बिकम्स एन एब्सोल्यूट इंडिकेशन ऑफ आईवीएफ. और इफ बोथ द ट्यूब्स आर रिमूव्ड फॉर सम रीजन, अगेन दैट बिकम्स एन एब्सोल्यूट इंडिकेशन कि मतलब यहाँ सिर्फ और सिर्फ आईवीएफ ही काम करेगा. The second indication is जहां पे सीमन में स्पर्म्स नहीं रहते हैं. So अगर सीमन है लेकिन उसमें स्पर्म्स नहीं है, there are no sperms in the semen sample, then IVF becomes the only route to pregnancy. क्योंकि फिर हमें टेस्टिस से या गोटी से स्पर्म्स निकाल के उनको यूटिलाइज करके फिर प्रेगनेंसी की कोशिश करनी पड़ती है, एंड दैट इज व्हाई व्हेन देयर आर नो स्पर्म्स इन द सीमन सैंपल, इट अगेन बिकम्स एन एब्सोल्यूट इंडिकेशन ऑफ आईवीएफ. The third indication is if you need a third party reproduction. What do you mean by a third party reproduction? अगर किसी वजह से कोई ऐसी मेडिकल कंडीशन हो जहां पे ओवरीज में अंडे ही नहीं है या अंडों की संख्या बहुत कम हो गई है, एंड देन यू हैव टू रिसोर्ट टू यूजिंग अ डोनर एग, जहां से डोनर से एग्स लेने पड़ते हैं, या तो यूटरस में कोई प्रॉब्लम है, नुक्स है जिसकी वजह से प्रेगनेंसी कैरी करना इस स्त्री को तकरीबन नामुमकिन या बहुत ही डिफिकल्ट है, जहां पे सरोगसी करनी पड़ती है. तो अगेन दिस बिकम्स एन एब्सोल्यूट इंडिकेशन फॉर आईवीएफ. सो जहां पे आईवीएफ के बगैर काम नहीं चलेगा, ये होती है फर्स्ट कंडीशन. सेकेंड कंडीशन इज कि आप बहुत देर, यू हैव ऑलरेडी ट्राइड वेरियस फॉर्म्स ऑफ ट्रीटमेंट, कि आप नेचुरली ट्राई करके देख चुके हैं, मेडिसिन लेके ओव्यूलेशन आपने ट्राई कर चुके हैं, फिर शायद आपने लैप्रोस्कोपी, हिस्ट्रोस्कोपी कर चुके हैं, आप बहुत बार इंट्रायूटेराइन इंसेमिनेशन कर चुके हैं, जहां पे यू टेक द स्पर्म्स फ्रॉम द मैन एंड पुट इट इनटू द यूट्रस ऑफ द वुमन. सो सिर्फ स्पर्म्स हम अंदर डाल रहे हैं यहाँ पे, और बाकी की प्रोसेस अंदर हो रही है, जिसको हम आईयूआई करते हैं. अगर आपने बहुत बार आईयूआई करके आप फेल हो चुके हो, तो देन दीज बिकम एंड अ कंडीशन और एन इंडिकेशन फॉर आईवीएफ, कि जहां पे मिनिमल ट्रीटमेंट्स आप ट्राई कर चुके हो एंड दे हैव ऑल फेल्ड, एंड दैट इज व्हाई यू नाउ नीड टू मूव ऑन टू एन आईवीएफ. दैट बिकम्स द सेकंड सिचुएशन अंडर विच आईवीएफ इज डन. द थर्ड सिचुएशन इज, सपोज इफ वुमेन की एज कम है लेकिन एग्स में क्वांटिटी, ओवरीज में एग्स की क्वांटिटी बहुत कम है, मतलब दिस वुमन हैज अ पुअर ओवेरियन रिजर्व, जहां पे एज अ वुमन एजेस उसके अंडे और कम 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 होते जाते हैं, एंड इवेंचुअली एवरी वुमन विल अंडरगो मेनोपॉज. तो जितने अच्छे अंडे और जितनी अच्छी क्वांटिटी में एग्स हमें स्त्री से मिल सकते हैं, when we get good number and good quality of eggs from the woman, IVF success rates are good. So even if the woman is young, और आजकल especially in India there are a lot of young women who have less eggs in their ovary, and that is why it is very important to understand this. So even if you have not been married for a long time, even if you are young, but there are very less number of eggs in the ovary, that is one more situation under which you can think of IVF. The next is, if in this situation again, suppose if the woman is older, she's an elder woman where you know there's been a late marriage, और किसी वजह से शायद marriage हो गई है, but you have postponed pregnancy due to some family situation, or now you are 37, 38 and you're trying for a pregnancy and you don't want to waste any more time, again this woman may become a good candidate for doing IVF. So there are certain situations under which we can do an IVF, and this will help. So just give me a minute. I have just written down some points so that I make sure that we are not missing out anything. So these are some of the conditions under which IVF is very important, and you don't kind of miss out anything, right? So like I said, कि Okay, so the next factor is, like I said, कि eggs कम हो या advanced age हो. The next factor is जहाँ पे any other form of treatment is possible, but probably will not give you a very high chance of success. What are these conditions? अगर there is severe endometriosis. Endometriosis is a condition जहाँ पे जो bleeding होता है, menses का bleeding होता है, जो बाहर निकलता है, that flows back inside the abdomen and pelvis of the woman. And inside there are, this bleeding all over the ovary and in the pelvis. And if this is present in a large quantity, again, IVF becomes a factor and will help such women. So these are some of the indications. And if you fall into any one of these criteria, कि अगर there is an absolute indication, tubes में कोई problem है, sperms में severe problem है, ovary में severe problems है, या age बहुत ज्यादा है, या एज कम है लेकिन ओवरी में अंडे कम है, या तो बहुत सारी चीजें आपने ट्राई की है और वो फेल हो चुकी है और अभी you need to proceed to IVF. One more very important thing I would like to tell everybody is, क्योंकि a lot of people who come to me say this, a lot of women say this to me, ki, they've been married probably at the age of 22 or so, and they come to us around the age of 28, and they've been trying for the last 6 years, and everything is normal. Agar hum unke test kare, to all tests look normal. And then when I ask them that, why have you not tried any treatment for 6 years? They say that we have been told, or our doctor has told us that, you're young, all your reports are normal, so there is no need to worry and you will conceive. My point always is that if you are having infertility which is unexplained, matlab sab reports normal hai, you're a young woman, aap sab test kar chuke hai aur sab normal hai, but you're still not conceiving, then this is a cause of worry. In fact, if a woman is younger, she should take a lesser time to get pregnant. So for me, if a patient is 22 years old and she's taking 6 years to get pregnant, there is something definitely wrong, even if all her reports are showing normal. Because there are many things, ये जो हम बोलते हैं cellular level पे, या ऐसी चीजें होती है जो टेस्ट पर नहीं दिखेंगी, but can be a cause of infertility. So we are not treating reports, we are treating the patient. So even if the patient is young, has been trying for 6 years and she's not conceiving and all tests are normal, again, this person could be a candidate for IVF for long-standing unexplained infertility. So these are the people who become the right candidates for considering IVF. Another important thing that I want to tell everybody is, most of the times thought ये होता है कि पहले let's go to the family doctor or a gynecologist, and then probably जब IVF की जरूरत पड़े, let us consult a fertility specialist. I again think that this needs to change, because fertility specialists का approach to infertility is very different. Gynecologist basically is trained to handle a woman. Lekin infertility is a condition where you have to look at both the male as well as the female, which is not something that just a gynecologist is trained to do, because basically that is a specialty for women. Secondly is that there are small things which if can be changed early on, आपको IVF तक जाने की जरूरत ही ना पड़े. So I always feel that आप जब भी consult करते हैं infertility के लिए, try and look for a good fertility specialist right in the beginning. ऐसा नहीं होता है कि आप अगर fertility center जाओ तो हमेशा आपको IVF ही करने को कहा जाएगा. ऐसे कई patients हैं हमारे पास who just come, we tell them कि सब ठीक है, आपको कुछ भी करने की जरूरत नहीं है, but we make sure that जो भी छोटी चीजें हैं जो प्रेगनेंसी के लिए हेल्प करेगी, वो सब हमने ठीक से देखी है, जांच पड़ताल की है, and now we have told this patient that don't worry, everything seems okay, please go back. So meeting the right doctor and a good fertility physician is important whenever you start your journey for infertility treatment, and not just when you need IVF. So these are the candidates for, who can consider IVF. Is my pace okay? Can all of you hear me? Is this format? I'm trying to, speak in English, Hindi, Marathi. I don't know the audience that we have. So if you can just type in the chat box that we are doing okay and this is being understood by all, that will help. All right. Okay. Good, thank you. So, just a minute. Right. And if you can in the chat box, keep typing questions that, you all want to ask, because we want this to be an interactive session. Is there any age criteria for IVF? I'm going to come to that. Now, what I'm going to do is the next step that we are going to go to. I am going to just in brief give you what is the process of IVF. So IVF में क्या किया जाता है is that we assess the patient. फिर पीरियड के मोस्ट ऑफन सेकेंड डे से वुमन को इंजेक्शंस दिए जाते हैं. नाउ ये इंजेक्शंस व्हाई डू वी गिव इट? बिकॉज वी डोंट वांट टू गो ऑन अ सिंगल एग. If you know, a woman produces only one egg every month, and that is why we have to we get only one egg from the woman. So we give injections because we want maximum number of eggs. Why do we want so many eggs? ये हमेशा ये क्वेश्चन आता है कि इतने सारे अंडे क्यों चाहिए. ये अंडे चाहिए क्योंकि हर एक अंडा अच्छा नहीं होता है. हर एक अंडे से एम्ब्रियो नहीं बनता है. हर एक एम्ब्रियो जो बनता है वो अच्छा नहीं बनता है. सो ऑन एन एवरेज इफ अ वुमन इज लेस देन 35 years of age, अगर हमें 6 अंडे मिले तो हम एक अच्छा नॉर्मल एम्ब्रियो बना सकते हैं. दैट इज व्हाई इट इज सो इम्पोर्टेंट कि हम इंजेक्शंस के द्वारा ज्यादा से ज्यादा अंडे बनाएं और फिर उन अंडों में से ज्यादा अच्छे embryos बना सकते हैं हम. That is the reason we start giving her injections from the second day of her periods. And these injections continue for about 10 to 12 days क्योंकि उस दरमियान ये follicles grow होते हैं और उसके अंदर अंडे बढ़ते हैं. जब ये पूरी तरह से अंडे mature हो जाते हैं, फिर इस दरमियान हम सोनोग्राफी और ब्लड टेस्ट करते रहते हैं. और जब ये पूरी तरह से मैच्योर हो जाते हैं तो थ्रू अ स्मॉल प्रोसीजर, please remember IVF is not a very difficult procedure. तो एक through a small procedure, एक छोटी सी anesthesia, short anesthesia देकर हम नीचे से एक नीडल के द्वारा वो अंडे बाहर निकालते हैं. जिस दिन वो अंडे बाहर निकले वो तुरंत लेबोरेटरी में जाते हैं. The husband has to give a semen sample on the same day. The embryologist जो लेबोरेटरी में काम करते हैं, एम्ब्रियोलॉजिस्ट, वो एग और स्पर्म को मिलाकर फर्टिलाइज करके उसका एम्ब्रियो बनाते हैं. ये एम्ब्रियो इंक्यूबेटर में रखा जाता है. The IVF lab is the heart or the backbone of any IVF center. So having a good lab, having an embryologist full time in the lab who is not just कि आज केस है तो आज आकर केस कर ली, ऐसा नहीं होता है. उस लैब को बढ़िया से बढ़िया स्थिति में मेंटेन करना बहुत जरूरी होता है. And that is why the embryologist has to be full time in that laboratory, not just when you're doing the IVF procedure. तो वो उस एम्ब्रियो को इंक्यूबेटर्स में रख के so incubator is like जैसे फीमेल के अंदर हाउ इन हर यूट्रस और इन हर बॉडी जो कंडीशंस होंगे उसी वो ही कंडीशंस बाहर क्रिएट करते हैं और उस कंडीशंस में उस एम्ब्रियो को बढ़ाकर फिर वो एम्ब्रियो जो बढ़ा हुआ है वो फिर से 3 या 5 दिन के बाद यूट्रस में फिर से डाला जाता है. Whatever extra embryos we have, जैसे मैंने कहा we make lot of eggs. So lot of eggs में से if we get lot of good embryos, हम 2 एम्ब्रियो अंदर डाल सकते हैं या इवन एक अंदर डाल सकते हैं. And the remaining embryos we freeze, जिसको हम cryopreservation कहते हैं. We freeze the embryos, ज्याला आपण गर्भ गोठवणे म्हणतो. So what happens is that जब ये embryos हमारे पास stored रहते हैं और बाय चांस अगर ये फर्स्ट IVF सक्सेसफुल नहीं हुआ तो फिर जो भी एम्ब्रियोज है हमारे पास वो एम्ब्रियोज लेकर हम नेक्स्ट साइकिल कर सकते हैं. तो फीमेल को फिर से इंजेक्शंस लेने नहीं पड़ते हैं, फिर से उस एनेस्थीसिया फिर से प्रोसीजर से जाना नहीं पड़ता है. सो दिस इज इन शॉर्ट द प्रोसीजर ऑफ IVF. Now, before I go on to addressing कि IVF में क्या problems और क्या questions रहते हैं, I'm just first going to take the few questions that are over here so that we address them before we go ahead. So, okay, so the first question is there any age criteria for IVF? So the answer for this question is yes and no. एज क्राइटेरिया क्यों है? क्योंकि जैसे मैंने कहा, इन द वुमन as she goes beyond the age of 35, and especially in Indian women, I would say at the age of 30 itself, एग की क्वांटिटी और क्वालिटी कम होने लगती है, और अल्टीमेटली अच्छे एम्ब्रियो के लिए अच्छा एग और अच्छा स्पर्म दोनों जरूरी है. तो अगर एज बहुत एडवांस हो गया, स्पेशली वुमेन का एज, फीमेल का एज अगर बहुत एडवांस हो गया, तो एग्स की क्वांटिटी और क्वालिटी कम किस्म की होती है, जिससे the embryo quality may not be good, and therefore doing IVF at the right time is very important. Generally we take the cutoff at 35, but there is a research which is showing कि Indian women ज्यादा जल्दी उनके eggs कम हो रहे हैं, इसीलिए हम Indian women के लिए cutoff between 30 to 32 रखते हैं. तो that is why if IVF is required, the earlier it is done, the better. At the same time, agar if a woman is, let's say, 40 years old or even older, and now for some reason pregnancy nahi hui hai and they wish to go through a pregnancy, you can take donor eggs, and that is why this criteria of age goes away. But when you want to utilize your own eggs and own sperms, then it is better that you do it within the right age limit for having a good success rate. कोई ऐसी एक single age नहीं है. If I have to say, I will say 35 definitely, but for an Indian woman, at least by 32, if she can understand and if IVF is required, then it is earlier she goes through it, the better. The question is, I've gone through IVF ICSI first cycle and conceived that it is ectopic. So is there any chance? Okay, now this is a very important question. Now, ectopic pregnancy मतलब क्या? Ectopic means जब हम embryo uterus के अंदर डालते हैं, तो वो embryo uterus में ना चिपक कर it goes and implants itself in the fallopian tube, most often in the fallopian tube. इसका मतलब कोई pregnancy जो uterus में ना रहकर uterus के बाहर रहती है, उसको हम ectopic pregnancy कहते हैं. Now, the pregnancy cannot survive in any place other than the uterus. So for a pregnancy to grow, it has to grow into the uterus. Now, generally, the chance of having an ectopic pregnancy in IVF is anywhere between 2 to 4%. Now, why is this? Because if we are putting embryos into the uterus, ये embryos uterus में ही चिपकने चाहिए. लेकिन कभी-कभी एम्ब्रियो ट्रांसफर के समय अगर यूट्रस में कोई कॉन्ट्रैक्शंस हुए, या यूट्रस का शेप ठीक नहीं हुआ, या ट्यूब्स में कोई गड़बड़ है, जैसे ट्यूब्स में कुछ थोड़ा पानी भर गया है या ट्यूब्स अच्छी नहीं है, तो वो एम्ब्रियो ट्यूब में पुश या पुल किया जाता है, एंड दैट इज व्हाई आईवीएफ में भी एक्टोपिक प्रेगनेंसी होने के चांसेस रह सकते हैं, बट इट इज वेरी वेरी रेयर. इट इज नॉट मोर देन अबाउट 2 to 4%. So is there another chance? I think first you should try and find out what was the reason for having an ectopic in the IVF in the first place, then correct that reason and then redo the IVF procedure. So the next question is, I'm a diabetic patient, age 34, is IVF an option for me? Yes, definitely IVF is an option. But see, it's not कि आप diabetic हो और age 34 हो तो आपको IVF करना चाहिए. There are so many other reasons. So every patient has to be looked into with detail. So suppose if a woman who is 27 comes to me, but says that, she's been trying for a very long time, maybe 7 years, and the egg reserve quantity of eggs has started going down, I may advise an IVF even for her. Whereas a 33-year-old woman comes and she says that, I've been just trying for 6 months and everything else is fine, I may still not tell that she needs an IVF. So her patient को individualize करना बहुत जरूरी है. But of course, if the question is, if you're a diabetic patient and you're 34, IVF can always be an option for you. But please understand, first you should correct the diabetes, correct the level of sugars, because IVF is not just कि एक अंडा ले लिया, एक sperm ले लिया, एक embryo create किया और अंदर डाला. That is not how IVF works. There is a lot more to pregnancy. We need to understand कि conception ये एक nature का in a way बहुत miraculous process है. तो ये सिर्फ egg ले लिया, sperm ले लिया, अंदर डाल दिया. No, your body has to be ready for that conception, for receiving that embryo. So जो भी problems है पहले से वो correct करना बहुत जरूरी है. What is the success rate of B grade embryo frozen on day 3? It's a very difficult question to answer. What is the success rate of a grade B, embryo? If you feel that this embryo, now again, like I said, you need to individualize. अगर आपके पास बहुत सारे embryos है और सारे grade B के हैं, तो my advice would be कि try and culture it to a blastocyst stage. और grade B के embryos जो blastocyst तक जाए, you already have the answer कि this is an embryo which is growing further, and then choose that blastocyst and use it for transfer. अगर आपके पास बहुत कम embryos है और सारे grade B के हैं, तो you can still go ahead and do the embryos transfer, but then the probability of success will depend on what your age is, what the reason for IVF is, how many embryos you are putting in, and what was the whole condition of the uterus at that point in time. So I would say even with grade B, if you have good numbers, you should still be able to get a decent amount of pregnancy rate with that. If I have to put a rate, it was going to be difficult because it is depending on so many other factors. आपका एज क्या है, आपका स्पर्म फैक्टर कैसे था, यूट्रस की लाइनिंग उस टाइम कैसे दिख रही थी, यूट्रस को ब्लड सप्लाई अच्छा था या नहीं. So there are many factors which are going to determine, but yes, you can get a good success rate even with a grade B embryo. It is not like grade B embryo will not implant. IVF session is to stop. So when can we and what should, so and at the age of, okay, so now I know that this lockdown has been difficult and सबके IVF postpone हो रहे हैं या delay हो रहे हैं, but एक is that most IVF centers have started functioning at a certain level now, taking all precautions. So अगर आपको IVF immediately करने की किसी कारण से जरूरत हो, तो I think please consult the doctor and see whether you can proceed with your IVF treatment. There's no need to unnecessarily delay it for a very long time if the center is now functioning with all the safety precautions, because जो हमारे organizations है, we have been given the go ahead that we can go ahead and do the IVF treatments, of course with all care that is to be taken. Secondly, what you should do to keep yourself fit is a very, very important point, and I would like to take this opportunity to tell everybody is that make sure that whatever you can do, जो आपके हाथ में है, your nutrition, eating right, sleeping right, cutting down on your tea, coffee intake, on your alcohol intake, if there is any smoking, all these things are very, very important. And in our center, we have made sure that we have a nutritionist. So, she can look into factors. Because of this lockdown, she is also not coming, but we are offering online consultations. So, we have a nutritionist who will look into this factor, make sure you're exercising. In our center, we also make sure that all our patients who are going through IVF, we conduct meditation sessions and other sessions for them. We have psychological counseling, so that in all ways, whether it is physical, mental, emotional, financial, we make sure at the center that we take care of all these factors. Because when you are centered, you are grounded, when you feel comfortable, you are less anxious, that is the time the IVF is going to work. So our center is open. We are continuing to function with all safety precautions. So you're most welcome to come and visit us at any point in time.
Madam, one of the participant is asking about Turner syndrome problem.
Okay, so what is Turner syndrome? So Turner syndrome is a genetic or a chromosomal condition. Chromosomes मतलब हम जिस genes से बने हैं, ये जो अंदरूनी hereditary जो हम कहते हैं, that we take from our parents and born. So these are the chromosomes that are present in our body. So हर एक chromosomes के दो पैर होता है, मतलब एक पैर होता है. Every chromosome is in a pair. So दो chromosomes होते हैं. So chromosome number 1 का एक पैर, chromosome number 2 का एक पैर. So this is how we have these chromosomes. Now Turner's में क्या होता है? In a female we have 2 X chromosomes and in a male एक X क्रोमोसोम रहता है और एक Y क्रोमोसोम रहता है. So जब फीमेल में 2 X क्रोमोसोम के बजाय सिर्फ एक ही X क्रोमोसोम होता है, उसको हम टर्नर सिंड्रोम कहते हैं. एंड दैट इज व्हाई व्हेन देयर इज ओनली वन X क्रोमोसोम, द ओवरीज डोंट फंक्शन वेरी वेल. they are streak ovaries. The ovaries don't develop properly, and in these women they have to utilize a donor egg. मतलब एग किसी और से डोनेट करके लेना पड़ता है, क्योंकि खुद के ओवरीज एग्स नहीं बना पाते हैं इस कंडीशन में. लेकिन यूटरस डेवलप हुआ होता है, क्योंकि जो ओवरीज जहां से डेवलप होते हैं इन द वूम्ब, इन द एम्ब्रियो, और यूट्रस जहां से डेवलप होता है, वो दो अलग those trees or those processes are different. So even if your eggs are not being formed properly, the uterus may be formed properly. So you can take eggs from another woman, fertilize it with your husband's sperm, and then put it back into the uterus. But of course a lot of things have to be checked कि कोई और problems नहीं है ना, blood pressure, heart problems, uterus अच्छी तरह से develop हुआ है ना, ये सब देखकर ही then you can proceed with treatment in a Turner syndrome. But in a Turner syndrome, more often than not, you will have to utilize egg from another woman.
Madam, one of the participant is asking about ICSI. Can you talk about ICSI? What is ICSI?
So what is ICSI? So ICSI, like I said, whether it is IVF or ICSI, for the patient, there is no change in the method of treatment. The change only happens in the laboratory. So IVF में हम क्या करते हैं, जो भी eggs we remove from the ovary of the woman, we take the husband's semen sample, we wash, we take only the sperms, and egg or sperms एक छोटी सी petri dish में इकट्ठा रखे जाते हैं. So egg के surrounding the egg, उस sperm को, उन sperms को छोड़े जाते हैं. So there is a particular amount for each egg, that each egg we fertilize with X number of sperms. तो egg और sperms बस इकट्ठे छोड़े जाते हैं, and the sperm will go and fertilize the egg by itself because it's so close to the egg, and then next day we see whether ये embryo form हुआ है या नहीं. Whereas ICSI में हम क्या करते हैं कि हम एक egg लेते हैं और एक sperm लेते हैं, एक sperm लेते हैं जो good quality का sperm दिखता है, and the embryologist in the laboratory injects the sperm into the egg. So यहाँ पे sperms अपने आप egg को fertilize नहीं कर रहा है, laboratory में embryologist एक sperm को उठाकर एक छोटी सी नीडल द्वारा उस स्पर्म को उस एग के अंदर डाल रहे हैं. तो इसको हम ICSI प्रोसीजर कहते हैं, which is called intracytoplasmic sperm injection. Now ये कब करना पड़ता है? अगर मेल फैक्टर इनफर्टिलिटी हो, जहां पे स्पर्म्स की क्वांटिटी और मोटिलिटी बहुत ही कम है, तो एक स्पर्म को फर्टिलाइज करने के लिए भी बहुत सारे स्पर्म्स लगते हैं. अगर इतने भी स्पर्म्स हमारे पास अवेलेबल नहीं है, या उस स्पर्म की मोटिलिटी इतनी कम है कि वो खुद ब खुद जाकर उस एग को पेनिट्रेट नहीं कर सकता है, देन अंडर सच कंडीशंस हम ICSI द्वारा फर्टिलाइज कर सकते हैं. Of course, there are many other conditions also where ICSI is utilized now. पहले ICSI was developed for male factor infertility, लेकिन अभी अगर woman का age advanced हो या severe endometriosis हो या कम number में eggs मिलने वाले हो, तो इस condition में भी हम ICSI द्वारा fertilization करते हैं, क्योंकि ऐसे समय में कभी कभी अगर एग के कारण अगर एग की क्वालिटी पुअर हो या एग को जो सराउंडिंग जो कोट रहता है जिसको हम जोना पेलुसिडा कहते हैं, अगर वो हार्ड हो जिसकी वजह से इट विल नॉट अलाउ द एग टू फर्टिलाइज, फिर आईवीएफ करने के बावजूद फर्टिलाइजेशन नहीं होता and then we don't get an embryo. There are conditions even apart from male factor infertility जहां पे हम ICSI utilize करते हैं, and this is what you mean by ICSI or intracytoplasmic sperm injection.
So the next question is, could you please share about hormones? She meant to say that what are the hormones which are required for good pregnancy or maybe responsible for infertility?
Okay, so you mean what hormones are required in your body for a pregnancy? Is that it?
Yes, madam.
Okay. See, the main hormones that you require for pregnancy are all the hormones that are required in the reproductive system. फिर reproductive system में क्या क्या जरूरी है? जो hormones अंडों से आते हैं और जो hormones uterus की lining बनाने के लिए necessary है, these are mandatory for having a proper ovulation and proper development. लेकिन ये जो hormones ovary से आते हैं, उनका control brain में होता है. So brain से hormones निकलने चाहिए, which will tell the ovary कि अभी आपको egg develop करना है. फिर एग जब डेवलप होगा तो ओवरी में से हार्मोन्स निकलेंगे, which will then act on the uterus and tell the uterus कि अभी आपको लाइनिंग डेवलप करनी है to receive a pregnancy. So there are many hormones which come from the brain, such as follicle stimulating hormone, luteinizing hormone, the thyroid stimulating hormone and the thyroid hormone, prolactin hormone, estrogen, progesterone, testosterone, and there are a few others, but these are the main hormones which should be functioning in the right manner and in the right amount in the your body for a pregnancy to take place.
She is also asking that what are there any food habits or lifestyle which needs to be maintained to maintain the balances of this hormone?
Absolutely, absolutely. See, please understand कि ऐसा नहीं है कि अगर your lifestyle and health is perfect, your reproductive system will work perfectly. I always tell that, if you see, there are a lot of women, ये जो construction site workers वगैरह होते हैं, they're not eating well, they're not sleeping well, फिर भी fertility is very good. There is one, they're holding one baby in their hand, they're holding one baby on the waist, and there's another baby in the stomach, and they're still working. So yes and no. Please understand, even if you're extremely fit, there could be a problem with your ovaries, there could be a problem with the sperms, and that is why it is so important to test it. But having said that, having a healthy body is important for anything in life, anything, period. What I always tell my patients is that हम क्या करते हैं ना, हमें अभी वो blinkers डाल के vision हो गया है कि ये आँख का problem है, ये uterus का problem है, ये stomach का problem है, लेकिन the body is a whole. The body is a whole. So for any of your system or organ to work well, as a whole, your body has to be in a good nutritious condition, in a healthy condition of body and mind. Many times, we take care of our body, but our mind is always, बहुत डिप्रेशन होता है, एंजाइटी होता है, कभी कभी बहुत रिसेंटमेंट और एंगर होता है कि मैं सब कर चुकी हूँ, मुझे नहीं होता है, बाकी लोगों को कितनी इजीली प्रेगनेंसी होती है. सो आई ऑलवेज से दैट फॉर फर्टिलिटी you need to have even fertile thoughts. So, everything has to be fertile around you. So nutrition is important, eating right, drinking the right amount of water, doing the right amount of exercise, and doing the right amount of mindfulness techniques, jahan aapki anxiety, depression, anger, anything that you're holding against yourself or somebody, बहुत बार गिल्ट होता है अंदर जिसकी वजह से हम एक्सप्रेस भी नहीं कर सकते. सो ये जो सारी चीजें हैं ये प्रेगनेंसी आने के लिए बहुत ही महत्वपूर्ण है. प्लीज ऐसे मत सोचिए कि बस एम्ब्रियो डल गया तो हो गया. A lot of things go, so that is why I would request everybody to look into all these factors and then proceed for a pregnancy or IVF.
Madam, the next question is there any test for embryo to check quality before transfer into uterus?
So there are two things. Okay, now embryos, the test is to physically look at the embryo. कि अभी देर आर ग्रेड्स ऑफ एम्ब्रियोज. सी तो डे 3 पे, डे 5 पे जब हम व्हेन वी विजुअलाइज, हम ये जो एम्ब्रियो देखते हैं अंडर अ माइक्रोस्कोप, सो वी कम टू नो कि दिस इज अ गुड लुकिंग मॉर्फोलॉजिकली गुड एम्ब्रियो एंड दिस इज अ पुअर क्वालिटी एम्ब्रियो जहाँ पे बहुत फ्रैगमेंट्स है, ए न्यूक्लिएशन है. सो ये अच्छा एम्ब्रियो नहीं है और ये अच्छा एम्ब्रियो दिख रहा है. बट हैविंग सेड दैट, even if an embryo is looking good, it may not be chromosomally normal. मतलब उसके अंदर की जो जीन कंटेंट है या क्रोमोसोम कंटेंट है वो कभी कभी अच्छी नहीं रहती है. सो नाउ देयर इज अ टेस्ट जहां पे हम उसको प्री इम्प्लांटेशन जेनेटिक स्क्रीनिंग कहते हैं, where you can test, you can take a few cells out of this embryo and check whether this is a normal, मतलब जेनेटिकली या क्रोमोसोमली ये एम्ब्रियो नॉर्मल है या नहीं, ये चेक कर सकते हैं. But this pre-implantation genetic screening is not to be utilized by everybody. It is to be utilized under certain conditions. क्योंकि जब हम ये करते हैं तब please understand, embryo में छेद करके you have to put a small hole in that embryo and you have to take a few cells from this embryo and send it for testing. So it's like doing a mini surgery on an embryo. So you have to do and you have to implement the right techniques in the right patient. Not that every patient should need to go through a pre-implantation genetic screening, but these are the main two ways of checking embryo quality. One is morphology and second is doing the pre-implantation genetic screening. There will come probably in the future a few other ways of determining, but abhi ke liye ye do cheeze hai.
Madam, the next question is which type of embryos are good?
Okay, now see, please understand, lot of people have this confusion कि embryos अगर freeze करके फिर अंदर डाल दिए तो the pregnancy rate increases. It is not like that. Why is a frozen embryo transfer success slightly better than the fresh embryo? Is because फ्रेश साइकिल में, जिस साइकिल में आप इंजेक्शंस ले रहे हैं, जिस साइकिल में आप एग्स बना रहे हैं, आप बहुत सारे इंजेक्शंस लेते हैं. सो आप बहुत सारे अंडे बना रहे हैं. सो you could form 10 eggs, 12 eggs, 15 eggs. So the body is used to giving you a pregnancy when एक अंडा डेवलप होता है, right, in a natural cycle. So उस अंडे में से जितना हार्मोन निकल रहा है, वो हार्मोन की लेवल जब शरीर में है तब उस यूट्रस को उस प्रेगनेंसी को एक्सेप्ट करना नेचुरल प्रोसेस में मालूम है. लेकिन इन एन आईवीएफ साइकिल यू आर टेकिंग इंजेक्शंस, यू आर मेकिंग 10-15 eggs and it is important or necessary to make that many eggs because you want good amount and good quality of embryos with you. But what happens is that the level of hormones goes so high and sometimes the uterus is reacting to that level of hormones, and then even if you get a good embryo, it may not stick in that uterus because for that uterus वो level of hormones is very high. So हम क्या करते हैं कि embryos freeze करते हैं और जब बॉडी में हार्मोन की लेवल इज मोर और लेस लाइक अ नेचुरल साइकिल, क्योंकि फ्रोजन एम्ब्रियो ट्रांसफर में आप अंडे नहीं बना रहे, आपके एम्ब्रियोज ऑलरेडी रेडी है, आप सिर्फ यूट्रस की लाइनिंग तैयार कर रहे हैं और वो हम जो नेचुरल एनवायरनमेंट होता है उस तरह से प्रिपेयर करते हैं. तो फिर जब हम एम्ब्रियोज अंदर डालेंगे तो उस एम्ब्रियोज को चिपकने का चांस ज्यादा होगा. सो इट इज नॉट कि एम्ब्रियोज फ्रीज होने के बाद ये एम्ब्रियोज ज्यादा अच्छी तरह से इम्प्लांट होते हैं, ऐसा नहीं है। वो एम्ब्रियोज फ्रेश भी अच्छे हैं, फ्रोजन भी अभी अच्छे हैं, लेकिन वो कब यूट्रस में चिपकेंगे उसके लिए आपको हर एक पेशेंट को इंडिविजुअलाइज करना पड़ता है। अगर आपने करेक्ट पेशेंट में फ्रेश एम्ब्रियो ट्रांसफर किया, उसका सक्सेस रेट और फ्रोजन का सक्सेस रेट सेम रहेगा। लेकिन अगर आप हर एक पेशेंट में एम्ब्रियोज फ्रेश में डाल दें जिनके हार्मोन्स बहुत हाई है या कोई ऐसी चीजें, तो फिर ऐसे पेशेंट में फ्रेश एम्ब्रियो ट्रांसफर का सक्सेस रेट कम होगा। सो इट इज मोर फॉर द यूट्रस एंड इम्प्लांटेशन रादर देन कि ये फ्रोजन एम्ब्रियो है और ये फ्रेश एम्ब्रियो है। आई होप दैट यू नो दिस रिजॉल्व्स द क्वेरी, बिकॉज it is true that frozen embryo may give you a slightly better success rate, but in a certain category of patients, if you individualize the right patient and do a fresh embryo transfer for the right patient in the right conditions, even there you can get a good success rate.
Madam, there is one more question related to this, that how many year frozen embryos will be in condition to use again after say like 2-3 years?
Absolutely no problem. See, please understand, when you freeze the embryos, they are frozen in time. तो आप जब तक उन एम्ब्रियोज को फिर से लिक्विड नाइट्रोजन से बाहर नहीं निकालते हो, तब तक those embryos are in the same condition. Right now, generally, the thumb rule is that we are allowed to freeze it for up to 5 years. So generally, after 5 years, the recommendation by ICMR is to freeze it for 5 years. But even if you use it after 10 years, they are in the same position as they were frozen. But of course, nobody, you know, like embryos are usually not frozen for that long. oocytes, eggs कभी कभी हम काफी देर तक फ्रीज करते हैं, but embryos are usually used within a matter of 3 years or maximum 4 years, so anywhere between 2 to 4 years. But time is not really such a big constraint. Whatever way you have frozen, till you take it out, they will remain frozen in that condition, whether it's 1 year or whether it's 5 years.
Madam, the next question is, are there any later side effects of IVF?
Yeah, so see, there is a huge concern around this कि IVF से बहुत side effects होते हैं. IVF is a very difficult procedure, and let me tell you one thing: IVF is not a very difficult procedure. When we do these major surgeries, sometimes even laparoscopies or other surgeries, IVF is a much smaller procedure compared to that. The difficulty is that IVF में uncertainty है कि आप IVF करें फिर भी शायद pregnancy ना हो, and this uncertainty becomes a huge issue of anxiety and worry for patients. So it is not that IVF leads to all kinds of complications, and that is why choosing the right center is extremely important whenever you do IVF. I cannot elaborate more on it because see, like for example, I am basically a gynecologist and an obstetrician, but we don't really, I'm not trying to look into every factor. We are concentrating on infertility, so we have full-time embryologist. Our laboratory has all the latest instrumentation, so our focus is IVF and IVF and IVF, and to make sure that do we give the best success rates with IVF. So it is very important that ye jo multiple pregnancies, more than 2, या ovarian hyperstimulation syndrome, या not recurrently getting poor quality embryos, all these things have to be taken care of, addressed before you start doing the IVF. And that is why, to avoid complications, choosing the right clinic is very important. Making sure that you have prepared yourself is very important. But having said that, agar IVF की complications देखे जाए, तो one है ovarian hyperstimulation syndrome, and in good clinics like for us, we have not faced ovarian hyperstimulation syndrome now for whatever more than 10 years or 15 years, 10 years at least. So one is hyperstimulation, जहां पे बहुत सारे अंडे बनते हैं और बहुत ओवरीज बिग हो जाते हैं. एंड फ्रैंकली IVF के लॉन्ग टर्म साइड इफेक्ट्स कुछ भी नहीं है. समटाइम्स पीपल फील कि IVF के बाद वेट गेन हुआ है, पीरियड्स इरेगुलर हुए हैं, बट इट इज नॉट कि ये IVF की वजह से ही है. hormones देने पड़ते हैं हमें, so sometimes hormones से you feel a little bloated, थोड़ा headache, all these things can happen. Also remember that there is a reason why people have to do IVF. तो there could be factors जो अंदरूनी problems हो जिसकी वजह से वो उभर आते हैं after IVF, but on a large condition IVF से long term complications या side effects, या कोई लोग सोचते हैं कि आप इतने सारे अंडे बना रहे हो तो मेरे अंडे जल्दी खत्म हो जाएंगे, ऐसा कुछ भी नहीं होता है। क्या कैंसर के चांसेस बढ़ते हैं? ऐसा कुछ भी नहीं होता है। So there really are not too many long term side effects of IVF. Short term side effects is mainly ovarian hyperstimulation syndrome, but now we are in an era of an OHSS free IVF clinic. So in the good IVF centers आजकल OHSS नहीं दिखता है।
Madam, next question is, if we increase the number of IVF cycle, then does it increase the chance of getting pregnant? She also asked that in case you are having poor egg quality and count at the age of 30.
So I think, yes, see, one of the major reasons why people don't get a success with IVF is because they fall out of treatment. They do one cycle and then they stop. Now we need to understand that IVF में सिर्फ एक साइकिल कर दिया और प्रेगनेंसी मिल गई, ऐसा गारंटी नहीं है। See, please understand that nature is above all of us. मतलब इवन अगर ये नॉर्मल एम्ब्रियो हुआ, क्रोमोसोमली नॉर्मल एम्ब्रियो होने के बावजूद भी 30% ऑफ द टाइम्स एम्ब्रियो यूट्रस में नहीं चिपकेगा। So the best success rate with IVF even today stands at about 50 to 61%, 62% pregnancy rate. So there's a possibility ki, you may not conceive in the first attempt. So usually on an average, you have to think that an IVF is going to give you a success rate of about 50-55%. Don't go with this ki IVF mein 75%, 80% success rate hai. And if that is going to be to happen, you will have to be prepared for putting in the embryos multiple number of times, maybe 8 fresh and 2 frozen embryo thaw cycles, or even if you have less eggs, then what happens is that agar, like I said some time back, ki ek normal acha embryo milne ke liye, if the woman is less than 35, she will need about 6 oocytes. So if I'm going to get only 3 oocytes from a woman, for whatever reason, maybe advanced age or poor egg reserve, then there's a possibility कि उन 3 eggs में से मुझे एक भी अच्छा embryo ना मिले, और अगर मिले भी तो अच्छा दिखे भी तो maybe it is not a chromosomally normal embryo. That is why I have to again repeat a cycle in this woman, again make 3 or 4 eggs and again retrieve and again make embryos in this woman. So it's very important to be prepared for a 3 IVF cycle. And in our center also for women, we design packages where, financially then they don't have to struggle, but they don't fall out of treatment. So we give them like a 3 IVF cycle package. So then they know that ठीक है, अभी अगर मुझे करना भी पड़े तो भी this is what is going to happen, and then that stress goes away. So you very important that please don't fall out of your treatments. एक बार अगर IVF success नहीं हुआ तो इसका मतलब ये नहीं है कि आगे चलकर नहीं होगा. So that is a very important factor.
Madam, the participant is asking about the blastocyst. What is blastocyst?
So अगर if you have, हम जब eggs बाहर निकालते हैं उसको हम day 0 कहते हैं. So आज अगर आपके eggs बाहर निकले, that is day 0. Then day 1, day 2, day 3, day 4, day 5 तक हम embryo laboratory में culture करते हैं. So जो day 5 का embryo होता है उस embryo को हम blastocyst कहते हैं. So that is an embryo which grows and becomes like a day 5 embryo. So a blastocyst is an embryo which has grown. It has formed one layer which is called the trophectoderm, and then there is an inner cell mass. So ये जो day 5 में जैसे embryo दिखता है उसको हम blastocyst कहते हैं. So blastocyst is a day 5 embryo.
Madam, the next question is, I have gone through IVF cycle. Out of 4 eggs, none of the eggs passed through blastocyst. She means embryos. What are the possible reasons for not getting good embryos? Doctor suggested to go for donor egg after cycle failure as egg quality is not good.
So, see, we get a lot of people who have been advised a donor egg. I truly feel that everybody is trying to attempt a pregnancy, wanting to use their own oocytes and their own sperms. So, I think every patient, just on one attempt, unless it's a clear cut case, कि eggs milenge hi nahi, ya she's 40 years old and the egg quality is going to be very poor, then under such conditions it is a different thing. But if the AMH is fine, if the age is within the right limits, एक IVF cycle में poor eggs मिलने से it is not necessary कि हमेशा ही poor eggs मिलेंगे. So one important thing that I wanted to cover, but it's a good thing that we are doing this interactive rather than me talking. But one of the important things I wanted to say is that it's the preparation for IVF is a very, very important time. In our center, अगर patient आ जाए और कहे कि हमें IVF करना है, we don't immediately start for IVF. We assess this patient कि उसके eggs कैसे मिल सकते हैं हमें, उसकी sperms की condition कैसी है, उसके uterus की condition कैसी है. Now, many times what I have observed in many centers is that पूरा focus सिर्फ वुमन पे होता है, बिकॉज IVF has become कि बस एग्स डेवलप करो, स्पर्म्स ले लो और एम्ब्रियो बनाओ. बट नो, 50% of that material in that embryo is coming from the man. So it's very important to understand कि इसकी sperm quality क्या है, यहाँ पे varicocele है क्या, बहुत fragmentation है क्या in the DNA, due to which embryo की quality खराब बनेगी. So it's very important to assess all this. But I would say again, every patient has to be individualized. ऐसा नहीं है कि एक बार अच्छे eggs नहीं मिले तो हमेशा ही poor eggs. We've had many patients जहां पे बाहर IVF करने के बावजूद eggs मिले ही नहीं है. They've been said, they've been told कि this is an empty follicle syndrome, and then we have repeated an IVF cycle, we've got eggs and given pregnancy to these women. So it's important to individualize. शायद सच में ऐसी condition हो कि eggs बिल्कुल अच्छे ना मिले और poor quality की मिले, या ऐसे हो कि definitely next cycle में we can give a good chance of getting good number and quality of eggs to this woman.
Madam, next question is, which is better transfer day 3 or blastocyst? And then what is better, IVF or ICSI?
See, like I always say, there's nothing hard and fast ki this is better, this is not better. And now a lot of research has been done कि day 3 पे डाला जाए या day 5 पे डाला जाए. Now, like I said, कि हर एक embryo जो day 3 पे है, वो हर एक embryo blastocyst तक नहीं grow करेगा in the laboratory or even inside the womb. So जब हम day 3 से embryos day 5 तक grow करते हैं, तो आज अगर day 3 पे मेरे पास 6 embryos हो, तो शायद blastocyst मेरे हाथ में 3 ही रहे, because that's the approximate conversion. So if you have less number of embryos, it is better to go ahead and do a day 3 transfer. So, but if you have a lot of embryos, then you can attempt a blastocyst transfer. Blastocyst से advantage ये है कि you can make sure कि ये embryo blastocyst तक गया है या नहीं, day 5 तक grow हुआ है या नहीं. So blastocyst, अगर blastocyst तक embryo पहुंचा है, तो you are more reassured that this embryo has grown to blastocyst and hence it has a higher chance of implantation. But then अगर आपको freeze भी करना हो, and if you have taken to blastocyst, आपके हाथ में embryos कम रह जाते हैं for freezing. And that is why again individualize the patient. ऐसे कई patients होंगे जिनमें शायद day 3 को transfer हो जाए, और ऐसे patients होंगे जिनको definitely you must attempt a blastocyst transfer. That is the answer to your first question. Second also is that is why I say that like we do the 3 cycle 3 IVF cycle in our center, where when you have good number of embryos in your hand, suppose एक cycle में नहीं मिला, so like we say कि sometimes when you are doing an IVF cycle, in the first cycle you may not get good numbers, or you'll be able to identify what the problem is, and that correction you can do in the second cycle. Many times I have seen that people, they just start changing. ये नहीं success हुआ तो फिर कहीं और जाके try करेंगे, कहीं और जाके try करेंगे. So yes, you can definitely, I'm not saying that you should not try and attempt to see which is the best center for you, but you have to stick around for some time so that person can assess in a proper way. That is why choosing the right center, like, is the doctor board certified? Are they concentrating on IVF? Do they have a full-time embryologist? Is their IVF center accredited? All these factors, do they have everything regarding, like in our center, the male factor infertility का हमारे पास separate department है. अगर कोई surgical issues लग जाए, for IVF, जैसे uterus का correction हो या tubes में पानी भरा हो, वो निकालने के लिए minimal invasive surgeries जो है fertility enhancing, उसका separate department है. Embryologist full time है. So what happens is हर एक चीज is looked into very carefully. So when you do that right in the beginning, automatically your success rates are going to be better. So that is more important than just deciding whether you have to just do a day 3 or day 5. That is one. Second is, it's not IVF or ICSI. Agar there is no male factor infertility, if suppose it's a tubal infertility, मतलब आपको पता है कि ये सिर्फ ट्यूब्स बंद होने के कारण हमें IVF करना पड़ रहा है, then by all means we should try and do an IVF in this patient rather than doing an ICSI, because उसमें फिर naturally वो sperm जाकर fertilize कर देता है and then you get an embryo. लेकिन कभी कभी the reason behind unexplained infertility, मतलब कोई patients ऐसे होते हैं जिनमें सब reports normal दिख रहे हैं लेकिन pregnancy हो नहीं रही है, that is a fertilization failure. मतलब किसी वजह से egg और sperms जो fertilization की process है वो हो नहीं रही है अंदर in the body. And even in these conditions, suppose if you just take these eggs and leave it for IVF, sometimes fertilization does not happen and then embryos are not formed. So you again have to decide किन patients को IVF लगेगा और किन patients के लिए ICSI will be the right option.
Madam, the next question is, what are the chances to get conceived at the age of 42 as wanting second baby?
One is get your AMH done, which is the anti-Mullerian hormone, and FSH done. So that will tell you how well your ovaries are functioning. Okay, that's very important. However, even if you have good quantity, which is unlikely at the age of 42, the quality will depend on your age. And therefore the fecundity, मतलब ये naturally pregnancy होना at the age of 42 is about only 3 to 5% in a natural cycle, or probably even lesser. So you probably will have that kind of a chance. But if your eggs are even less in quantity, the chance could be even just 1 or 2% in a natural cycle at the age of 42 with a poor ovarian reserve.
Madam, is there any treatment to improve egg quality?
Yes, yes, because your nutrition is very important. There are some medicines which will help the cytoplasm of the egg function in a better manner. So those medicines can help you. Having a good exercise pattern, and in our center we conduct some sessions for visualization where you are concentrating and improving the blood flow to your uterus and your ovaries. So all these things like your nutrition, certain medications, exercises, and processes of some kind of meditation, visualizations, if you can do all this together, now you can be able, your body will inherently then try and generate better quality of eggs.
Madam, the next question is how to improve AMH, and what is LH hormone and its effects in IVF?
Okay, you can't change AMH really. Okay, there are no medicines to increase or decrease AMH. AMH tells you the egg reserve, kitne eggs hai individual egg reserve. So this woman, even if the age of the woman is same, एक में ज़्यादा अंडे रह सकते हैं, एक में कम रह सकते हैं. So AMH tells you the quantity or the egg reserve, and you can't really change the quantity. Whatever you are born with, that is what it is. There are experiments going on where, you know, we'll try and see कि जो ovarian stem cells है उसी में से थोड़े अच्छे, you know, how we can get it to become a good quality oocytes, but that research is going to take time to come. So for the present moment, there is nothing you can do to change your AMH value. That is one. What was the next question?
Madam, how to improve, what is LH hormone and its side effects? Its effects in IVF, sorry.
LH hormone is the hormone which is important for the estrogen development from the egg, the quality of the egg, and the ovulation. मतलब जो egg फूटता है, you know, the ovulation. That is in a basic thing. See, as doctors, there are lot of factors where LH plays a role, lot of areas, but I can't go into the medical thing. So basically for you, LH is important for a good egg development, for the proper amount of estrogen to come up, and for ovulation. And in IVF, LH tells us that, you know, are you closer, what is the kind of medicine that you can use for the trigger, you know, if the estrogen level is low, do we need to add a little bit of medicine containing LH to bring up the estrogen level or the number of follicles? That is something that the doctor will look into.
Madam, this is the last question. What is DNA fragmentation?
Okay, so we are talking about DNA fragmentation in the sperm. That is what I'm presuming. Right.
Yes.
So, see, when we do a sperm semen examination, we generally look at the count, motility, and the morphology. Morphology means does the head have one head, one tail, and you know how a normal sperm should look. But inside the head of the sperm, there is a DNA, and it is this DNA that will fuse with the DNA of the egg, creating a new embryo. So sometimes there are breaks in these DNA because of environmental factors, obesity, smoking, you know, alcohol intake, obesity, like I said, or conditions like varicocele. And then if there is a fragmentation in the sperm, it will lead to poor quality embryos. And that is why we need to sometimes test, and we have to decide in which men we should go ahead and test the sperm DNA fragmentation.
Madam, thank you very much. And all the questions I think we have covered. You have any take-home message to share?
Yeah, I had some important take-home messages that I wanted to tell everybody. One is that IVF is a safe and time-tested method. So please do not worry about, you know, whether this is something that will lead to abnormalities in the baby or something like that. It is a time-tested treatment that is there, and there is no evidence to say that, you know, IVF leads to a much increased anomaly or problems in the baby. You can continue the IVF procedure while doing regular work. You don't need to take complete time off. You don't need to have complete bed rest. All those things are things of the past, and you don't need to do anything of that sort now. The third thing is that a lot of people worry that it is associated with multiple pregnancy. So yes and no. So, it is in our hands to decide कि अंदर कितने embryos डालने हैं. अगर हमने एक ही embryo डाला तो एक ही pregnancy होगी. अगर हमने दो डाले तो शायद एक होगी, शायद दो होंगे, शायद maybe unfortunately कुछ भी नहीं होगा. But we can decide how many embryos to put inside, and we generally don't put in more than 2 embryos unless there is some specific indication to put more than 2 embryos. The next thing is that one very important thing is that, like I said, please don't think that, you know, IVF is associated with 100% success rates. Most of you know that now, but a good IVF center is not somebody who will tell you कि हमारे पास 80% 90% सक्सेस रेट है. ऐसा नहीं है, नहीं होता है. इवन इन सेंटर्स जहाँ पे हर एक एम्ब्रियो, लाइक देर आर सम सेंटर्स इन द यूनाइटेड स्टेट्स और इन ऑस्ट्रेलिया जहाँ पे हर एक एम्ब्रियो पे प्री इम्प्लांटेशन जेनेटिक स्क्रीनिंग किया जाता है. मतलब ये एम्ब्रियो नॉर्मल है या अबनॉर्मल है चेक किया जाता है और फिर वो ही एम्ब्रियो उठाकर अंदर डाल देते हैं. इन सेंटर्स में भी प्रेगनेंसी रेट तकरीबन 61% है. सो please understand that it is not associated, and don't go by that. Prepare yourself, choose the right center, and know that if you have good embryos, once you have good number of embryos and good quality, and with one fresh, and maybe if you do one FET or two FET, the pregnancy will come. And nature is, there is a play of nature, और ऐसा नहीं है कि just put a good embryo and pregnancy हो जाएगी. So be prepared for that. When you're prepared, it reduces your anxiety, it reduces this continuous worry about your finances, and then it becomes much easier to go through the process. So before we end, I really truly hope that this chat has helped people understand stuff with IVF. And if you have any queries, if you want to consult us, we would be very happy. You can come to our center. It is in Bakad, and this is the address and the phone number, and we'll be happy to answer any questions, queries. If you have any failed cycles previously, trying to understand why that has happened. If there are people who want to have like a 3-cycle IVF to be done for whatever reasons, those possibilities are also present. So thank you for being with us, and it's been lovely chatting with all of you.